Well, good evening, everyone. This is Brian Harmon, President and CEO of the United Mitochondrial Disease Foundation. Thank you so much for joining us this evening. First and foremost, I hope everyone is finding their way through these uncertain times. And I want you to know UMDF will continue to do its part in helping you to navigate. We're going to be working to bring you fresh information like we are tonight and access to mitochondrial disease experts from around the globe, so you can continue to make informed decisions for yourself or your family. We're going to keep adding relevant content to our website and YouTube channel. And earlier today, we announced a new event in replacement of the event that we can't have now at our annual symposium. We announced the Power Surge 2020, a two-day virtual program jam-packed with info for the mitochondrial disease community, that will be held on June 26th and 27th. So this will be in place of our since canceled symposium due to the COVID-19 outbreak that we had to cancel. Registration details for this are coming soon, so please keep an eye out on social media and your email. Our goal is to continue to bring you great and relevant information. We've also partnered with Dr. Peter McGuire at the National Institutes of Health, who you'll hear from later tonight, to promote a study that can help us understand the effects of COVID-19 and mitochondrial disease. So check your inbox, your social media channels, and all this information can be found on umdf.org/coronavirus. Of course, none of this is possible without the generous support of our sponsors, who have not only made a commitment to UMDF, but to the entire Mito community by sticking with us during this time. They've been unwavering in their support, and for that, we're very grateful. And we're grateful for our network of Mito experts, who you're going to have a chance to hear from tonight and have your questions answered. They stand at the ready to provide education and connect with our patient community. So we're delighted to have our friends in the Mito community, our experts, with us this evening. And lastly, we're inspired by all of you, the patient families we serve. We have a little mantra around our office about kicking down doors. And certainly these last couple months have really tested the power of our kick. But we're going to kick this one down too, together, like we always have. And it's something I think that makes our community very special. A patient advocacy group like UMDF, inspiring patient families, courageous patient families, and the doctors who work hard every day to help bring us answers. So thank you again for joining us tonight. I'm now going to kick it off by turning it over to UMDF Director of Communications, Cliff Gorski. Cliff, please take it away.
Thank you, Brian, very much. Thank you for the kind words. And please allow me the pleasure of introducing to you our panel this evening. We have Barbara Marriage, and Dr. Marriage is an expert in genetic metabolic disorders. She is also a pediatric research dietitian and scientist with Abbott Nutrition. Also joining us today is Dr. Peter McGuire. He is a physician scientist in the Medical Genomics and Metabolic Genetics branch at the National Human Genome Research Institute of the National Institutes of Health. Dr. Hilary Vernon is an attending physician at Kennedy Krieger Institute and an assistant professor of pediatrics at Johns Hopkins University. Dr. Rebecca Ganetsky is an assistant professor of pediatrics in the Division of Human Genetics, and she is also an attending physician in the Mitochondrial Medicine Frontier Program at Children's Hospital of Philadelphia. And Dr. Fernando Scalia is a professor of molecular and human genetics at Baylor College of Medicine in Houston, Texas, and a metabolic and clinical geneticist at Texas Children's Hospital, also in Houston, Texas. Panel, thank you for joining us and for being so generous with your time today. And since this is the second part of a webcast series on the coronavirus and its impact on our patient families, we are going to be restricting questions to those that deal with this topic today. You are also invited to submit your questions. Many of the questions that were submitted in advance are very similar in nature, so we combine them to make sure that we are able to answer all of your concerns in the time that we have today. Also, after we answer the questions that have been submitted online, we will take your questions. And when you submit a question, I ask that you tell us the doctor's name in your question that you want your question directed to. That will help us greatly. So we ask that you be able to do that. So let us begin. Dr. Scalia, I'd like to begin with you. And the question is, how does having mitochondrial disease impact the risk of getting the coronavirus?
So that's an excellent question. I don't think we have enough data to answer that question conclusively, but I think that there is evidence, and actually that evidence obviously is coming from the work done by Dr. Peter McGuire at National Institute of Health, that children with mitochondrial disease have decreased immunity when they receive vaccinations. I mean, so they don't respond to vaccines as well. That's what we call the adaptive immunity. But let's say that when we are exposed to infections, there is a theoretical risk that there could be an overdrive of inflammation. And, you know, we know that, let's say in general, patients, and now we have this information that patients or people who are affected with COVID-19, but I'm not talking about mitochondrial disease in general, may have kind of like an inflammatory overdrive, like an excess of inflammation that may be leading to, you know, several complications. But I don't think that we have like enough data on patients with mitochondrial disease. At least I should say, I do not. I think that perhaps Dr. McGuire, I mean, may want to elaborate more on that. Yeah.
Yeah, hi. Thanks, Dr. Scalia. So yes, you're absolutely correct. We, at this point, don't have a complete picture of what the immunologic function is in patients with mitochondrial disease. However, we have made a few observations, and one of which is the one that you mentioned with vaccine preventable diseases. For certain vaccines, there seems to be a lower kind of uptake or the presence of those protective antibodies in children with mitochondrial disease. From that study, what we don't know is that whether did the patients not develop that immunity in the first place, or did they, and they lost it over time? So that's something that we're actually looking into. The second thing that you mentioned about this hyperinflammation, this we do have, and it's very preliminary at this point, I have to say, but we do have some data in patients, about 40 mitochondrial patients versus healthy controls, where you look at the transcriptional profiling. So in other words, for our listeners, this is basically what are the signatures that are inside the cells that kind of tell you, identify what those cells are doing. And we do see, versus healthy individuals or individuals without mitochondrial disease, some signatures of inflammation in the absence of any ongoing infection or anything like that. So it is possible that, you know, patients with mitochondrial disease may have this propensity for inflammation. This, of course, is also supported by mouse models of mitochondrial disease, including Lee syndrome, where these animals are actually hyperinflammatory and have inflammation at baseline in various tissues in the absence of any illness or infection.
Dr. McGuire, I want to stay with you for a minute. So we sent out an e-communications piece on a study that you're working on. Tell us a little bit more about it. Patient families should have received that today.
Yes, so this is, I mean, for those of you who do know us and know the work that we do, we have been interested in viral infections and mitochondrial disease and immunity for quite some time. I mean, that's essentially the name of our section. It's metabolism, infection, and immunity. So the study that we are currently running, in addition to our study at NIH, is looking at this impact of COVID-19 currently on the mitochondrial disease community. So it's essentially in 3 phases. The first phase, some of you may have filled out a questionnaire that we actually have online, which asks about your experience during this current pandemic and your access to medical resources, yourself or the person you care for. So your access to medical resources, any symptoms you may have had, have you been diagnosed with COVID-19? And we've had over 420 respondents to this survey, which went out via multiple platforms, including the UMDF. And so far, fortunately, we only have one family that has reported an individual actually having COVID-19. One thing, though, that is coming out of this that is somewhat concerning is a fair number, I think it's about maybe 40% or so, have individuals who have to work outside the household and have public contact. So in other words, increase the risk of potentially bringing back infection essentially into the household. So the survey actually wrapped up, the first iteration of this survey wrapped up today. So that's essentially around a month's worth of collection. We will actually administer the same survey about 4 weeks from now, or give or take, because obviously this is a moving scenario, and we want to be able to capture people's experience as this situation evolves. We will also be releasing some results to people at the same time to let them know that how their experience may compare to to other individuals. So they'll get some kind of summary data essentially in terms of their responses. So then the second phase, which you mentioned, has to do with monitoring individuals when they become ill. So a listing went out today where individuals with mitochondrial disease who have contracted COVID-19, we wish to be in contact with them and their local care teams to monitor their illness. And that, that can involve numerous steps, which basically can be collection of medical records. And then, in certain circumstances, if it permits, we actually want to try and collect some blood samples where we can actually send kits to the families or to their home teams. So we can try and understand the immune response to this virus and the virus itself a little bit better. The third phase will come after this whole pandemic thing may actually come in waves, is what we're kind of hearing. So after the kind of first wave, and hopefully maybe the only wave, we then want to go back and evaluate serology of these patients. So in other words, to see if they were exposed to COVID-19 and whether they developed symptoms or not. And we'll be doing that for patients with mitochondrial disease as well as their family members to kind of assess, essentially, was there risk in the household, and then did individuals actually develop any symptoms of disease? So that's something that will be coming after, a little bit while after in phase 3, which is probably around the fall or so, I would say.
So Dr. McGuire, do you think it is possible to boost immunity against COVID-19?
Yeah, I mean, there's no specific data about COVID-19 per se, but in general, for maintaining health against any type of virus, whether it's COVID-19 or influenza or rhinovirus or any of the things that are potentially triggers for mitochondrial patients, things like good nutrition, which Dr. Marriage could probably speak to, practicing the CDC guidelines with regards to maintaining distance, hand washing, the guidelines for being out in public. But in terms of boosting, I mean, there's some information out there about zinc as well, which can be potentially helpful with viral infections. So it really is, it's probably more centered around leading a more healthy and now somewhat cautious lifestyle versus having something very specific that can boost the immune system. I mean, of course, any types of vitamins and things like that, which help supplement or health in general, or anything that the patients may be taking in terms of their cocktails. Those are things obviously that would still be encouraged, but there's really no kind of magic bullet to kind of just boost the immune system.
Dr. Vernon, we've had many questions about exposure. A lot of patient families are concerned about personal items, surface contact. And one of the questions was the different types of surfaces. Do we know anything about how long this virus would live on surfaces? For example, paper, cardboard, mail, money, boxes, those kinds of things. Do we know anything about that?
Yeah, and there's actually two separate answers to this question. The first is how long the virus can live on surfaces, which we do know a bit about. And the second question is, does that pose a risk to people who come in contact with those surfaces? So we know what's been reported through the CDC and through the World Health Organization, that even though the virus can live on surfaces, there haven't actually been any documented cases of the virus being transmitted, say, on food products or food packaging or things like that. So that's been a big question we've got a lot of, is it safe to get things from the grocery store? So in terms of how long, so yes, in general, there has not been transmission on those kinds of surfaces, but we recommend a lot of clean practices, and that includes frequent hand washing with both soap and water, and using an alcohol-based rub that has greater than 70% alcohol. So hand washing frequently, and wiping down surfaces with and there's certain things that are recommended on the CDC website as well, because we know that the virus can live on the surface for up to 9 days for some hard surfaces, much less than that for other surfaces. It's a real variable amount.
Dr. Marriage, on our last webinar, we heard some patients who were doubling the dosage on their Mito cocktails. They were wondering what your thoughts on something like that would be, given this situation we're in.
Yeah, so that's a very good question, because as Dr. McGuire had spoke about, nutrition is so important during this time. But I would not recommend doubling the doses of the cocktail. I mean, those are, recommended by their healthcare professional, and a lot of times pharmacological doses. They're not like the doses that you would get on a small multivitamin that you buy in the store. The other problem, if they're trying to do something like that, is if you take way more vitamins and minerals than you require, your body needs to get rid of kind of the waste products from that. And so, you would require more hydration perhaps, and more fluids if you're taking additional doses. So I definitely wouldn't recommend taking extra doses. We can talk later. Maybe there's things, that are known to be linked to immunity, like zinc and vitamin D, but good healthy diet probably provides those, but definitely not increasing the cocktail that's recommended by their healthcare professional.
Okay, thank you. Dr. Ganetsky, is it correct, one of our patients wants to know, that providing fluids to COVID-19 patients be limited due to the risk of a fluid buildup in the lungs? And I ask that because patients suffer from chronic dehydration and low blood pressure. So the question is this: is there a protocol that a patient should follow with COVID that differs from a normal patient without mitochondrial disease?
Yeah, that's a really important and really challenging question.
Okay.
I think the first thing to say is, if you don't have COVID, or you have a mild case and you're able to stay at home, and you're talking about home hydration, hydration we know is important, and home hydration is safe. The times that we worry about hydration, we worry about IV hydration, especially in adults when they're getting fluid overload in their lungs and or their heart isn't able to manage the amount of fluid that they're getting. And those are people who are usually sick enough that they are in the hospital, and often what we're talking about now are people who are in the intensive care unit. In that situation, it is challenging to kind of dial in the right level of fluids between making sure that a patient is adequately hydrated and trying to make sure that the fluid that is going in through the IV is staying in the blood vessels and isn't going too much into the lungs or into the kind of space in between organs and blood. This is not a unique problem to COVID. This is actually a problem that we face in other critical illnesses. And it's something that intensive care providers are really very familiar with, trying to look at markers for what we call the intravascular, how much fluid is in your blood vessels, hydration statuses, and the whole body fluid status. And so what I would say is that this is a challenging topic. It's not a topic where I could give you a specific prescription, but it's something that most physicians are aware of and able to kind of dial into the right amount. And if you are at home with COVID, it's something where you can really continue on with your or your child's hydration protocol.
Okay. Dr. McGuire, back to you. We've been hearing a lot about the impact this virus has on our immune system, as you've even talked about. So can you talk about what this really means to our immune system response and any possible treatments that we should stay away from or drugs that we should not use? Because I'm sure you've heard people were afraid to take ibuprofen, or we've heard that in the news that it allegedly enhanced the effects of the coronavirus. Is there anything that should be avoided or anything that we should do to boost?
Yeah, so that's a great question, and I wish I had a really clear answer for you. I think at this point, you know, there has been such information overload, and in a very short period of time, and that information overload also, for certain things, seems to change. And I don't want to say from day to day, but you know, over time it does seem to change. So, you know, initially, so I'm going to give you a long answer. So initially, you know, there was this promise about, you know, hydroxychloroquine, right? And it's a drug for malaria, and it could be helpful for preventing the virus from, you know, it's the infectious cycle of the virus, essentially. So that seems to have fallen out of favor because of some of the cardiac manifestations that are, you know, kind of manifesting themselves in patients even without mitochondrial disease. Hydroxychloroquine would be of concern in patients with mitochondrial disease because there are reports that long-term use of hydroxychloroquine can actually result in a myopathy with changes in the mitochondria. So, so that might not actually be a good drug to use based on the, you know, some of the cardiac effects as well as its potential. Some of the other drugs like remdesivir, so that has not, and so we've been doing this. We've been looking at these drugs to see what effects they have on the mitochondria, positive or negative, because we're putting together a review to put this out. And remdesivir, at least at this point, we have not been able to find any evidence, positively or negatively, with regards to its effects on mitochondria. It seems to be specific for the viral polymerase itself, because that's what it targets. But, you know, once again, an absence of evidence doesn't necessarily mean it's safe. It just means right now, at this point, with the evidence that we have, there doesn't seem to be any ill effects with regards to remdesivir that have been discovered. Other things like, you know, some of the anti-HIV retrovirals, some of which are actually already contraindicated in mitochondrial disease anyway, because of their effects on, you know, mitochondrial DNA or replication, et cetera. Other things that are out there now, so you probably heard there's a lot of talk about convalescent plasma or hyperimmune immunoglobulin. So this has to come with testing, of course, right? So you have to be able to identify individuals who have had COVID-19, who have recovered from COVID-19, and actually produce antibodies that can be potentially protective against COVID-19. So these are essentially therapies or immune-based medications that you can use during an infection with COVID-19, where the antibodies that you get from someone else can help either ameliorate or attenuate the disease or help speed recovery, et cetera. Other things that they're looking at with addressing this idea of a cytokine storm or hyperactivation of inflammation or the immune system are things like cytokine inhibitors. And at this point, there's insufficient clinical data to basically, you know, regarding any recommended use for it. But the idea is that if you block these kind of little mediators of inflammation, that, you know, it may be helpful in kind of, you know, ameliorating or at least preventing some of the deleterious effects of having a cytokine storm in patients. So those are under evaluation in various clinical trials, but at this point, insufficient evidence. And then the last thing are other immune modifiers, which look at things like interferons, for instance. So interferons are antiviral cytokines that are made by the immune system, which help warn cells that there's a virus nearby and shut down your machinery because we don't want the virus to replicate and all these things. So for that, you know, looking at things that target interferons, At this point, the NIH, in this kind of panel that they convened, recommends against that because there was a lack of efficacy in SARS. So back in, was it 2002, where we had the SARS infection, as well as lack of efficacy for MERS, which was Middle Eastern Respiratory Syndrome back in about 2017, 2016. And there was also toxicity associated. So that's probably not, going to be as helpful. As well as these other things called Janus kinase inhibitors, which also are considered immunomodulators. So right now, it seems that in lieu of a vaccine, it looks like potentially convalescent or hyperimmune immune globulin and potentially remdesivir, or in combination with potentially some other antiviral on the treatment front, seem to be the most promising. Now, with that being said, this, of course, is a moving target, and there are numerous trials going on right now. If you just look at clinicaltrials.gov, you can see essentially some of the lists of what's going on, as well as at the NIH Clinical Center itself, where they're running some trials on these antivirals. So at this point, that's kind of the current state of what people are thinking about in terms of treating this infection. But nothing prophylactically, nothing, we're not there yet, and that's not what we're thinking in lieu of a vaccine.
That's going to be a while.
It is going to be a while, yes.
Before I move on to the questions, just a couple of housekeeping things I'd like to talk about. If any of you on the webinar, on the webcast, would like to ask a question, at the bottom of your screen, there's a Q&A box. So just click on that and submit your question. And my colleagues, Kara Strittmatter and Margaret Moore, are monitoring those and will take those questions and forward them to our panel. And secondly, I'm going to go back to questioning with Dr. Marriage. Doctor, we're having a little bit trouble hearing you. Not sure if your microphone is kind of an issue, but the question is that in addition to daily multivitamins, and we've talked about this in previous questions, and it is recommended that people take their Mito cocktails, but are there any other supplements that you feel would be appropriate to add to the regular Mito cocktail that you could recommend that patients take?
So that's an interesting question, because I think you'd have to individualize it, because everybody's Mito cocktail is very different. For example, you may have people that are just taking CoQ and creatine, but you would have others that have high doses of vitamin, B and C, etc. So my recommendation is really, again, to talk to your healthcare professional. We do know, though, that there's certain nutrients that are associated with helping the immune system, like vitamin A, vitamin D, E, vitamin C, zinc, selenium. So those are nutrients that you could get from a healthy diet, but you would have to look at the whole kind of spectrum of what someone's taking. If they perhaps during this period of time, maybe they're worried, don't have the condition themselves, but they're worried, they have family members that do it, they're not eating well. So, a multivitamin that has smaller amounts in might be recommended, or a nutritional supplement that has all those things, because protein is very important also to help with the immune system. So, it's not an easy answer. It's kind of, you look at their diet, what are they already taking? And, would it be helpful to take a multivitamin during that time if they're not eating well? It's kind of debatable, but really nutrition is so important during this. It's important all the time, but it's so important, especially if you're trying to make sure your immune system is the best it can be and to help it as much as you can.
So any tips, because we're all at home and we're all together, and any tips of making sure that you're getting your proper nutrition during the day?
Well, if you saw what I ate today, just do what I say and not what I do. But I mean, really, it's kind of going back to what our mothers probably already told us, to have a good balanced diet, right? So to make sure you're eating from all 4 food groups, making sure you're well hydrated during that time. And when you're at home, I mean, follow the routines you usually do. So sometimes I think when you're at home, it might be easier to go to the fridge, or you're on conference calls all day long where you don't get to go to the fridge. where you need to look at what is a good eating pattern, right? So having a good breakfast, lunch, dinner, and just try to be as normal as you can with your eating habits, regardless that you're blocked up at home. And as well as incorporating exercise, you know, and making sure you get out, get some fresh air, try to keep as healthy as you can.
Dr. Scalia, we were talking before we went on, you were kind of telling us what was going on in Texas. And I know the cases have flattened in some areas, but that's not the case everywhere. So if patients are still being diagnosed with coronavirus, and a patient is asking this, if they, the patient with mitochondrial disease, contracts the virus at this point, how best should they treat this at home? I would assume that they would call their primary care physician, but how best would they treat this at home?
Well, I mean, I think that, you know, if the patient has already been diagnosed, and let's say that they are in the in the Houston area, and we have, you know, two groups here. There's the group of Dr. Koenig at Memorial Hermann. There's our group at Texas Children's Hospital. I think ideally, you know, parents or caretakers in case of adults, or the person itself who actually has contracted COVID-19, as you stated, I think that should, you know, communicate with the primary care provider. And then, you know, in fact, I mean, now there are obviously telemedicine has opened up as a possibility. And if they are able to like establish a communication via like a secure phone line or even like video, like we are doing now, then they can be screened and determine, okay, you know, is it safe to stay home? And if really like the symptoms of the disease are minimal, then I think getting plenty of hydration, good rest, nutrition, and I think that should be at least one of the first measures that can be taken. And I think that also communicating with, you know, with our group. I think that like any other centers, you know, we do give to families emergency contacts for like after hours, weekend, holidays, like, you know, round the clock. We do have a service that actually would answer questions, and you know, we can be in communication with the primary care provider, or the primary care provider can be in communication with us and the family.
Okay, thank you. Dr. Ganetsky, as states are starting to reopen, and we see it on the news every day, some states are doing some things, other states are still in a lockdown state, so to speak. So not everybody's the same. What precautions would you recommend for patients depending on the situation? For example, in Pennsylvania, we have a three-tiered approach where right now we're still in red, so we're still practicing social distancing and wearing masks outside, but that will ease up as time goes on. What would you offer to patients, especially those with the underlying medical conditions and the risk factors that they may face in this gradual reopening across the country?
Yeah. So as you said, it's certainly different in every municipality. And as Dr. McGuire said, we're still learning a lot about what's going to happen as we get out of phase 1, and whether we're going to see resurgence of the disease as people emerge into the reopening. And I think for our patients with mitochondrial disease, especially the ones who have the comorbidities that we know really increase the morbidity and even mortality of COVID, which are people who have heart disease, especially a cardiomyopathy, people who already have some degree of respiratory insufficiency, people who have kidney disease, especially kidney insufficiency and being dialysis dependent. Those are people who are extremely high risk for high morbidity and mortality. And what I would recommend to you is do as much mitigation as possible. The cornerstone of mitigation, the thing that we know works, is what I read an impassioned plea to call it physical distancing instead of social distancing. Socially, you have the internet, and please continue to be socially active. but physically distance yourself as much as possible from other people. That means not just staying 6 feet away from people, but trying to avoid contact with people outside of your household as much as possible. So yes, sometimes you have to go to the grocery store, but if you don't need to be doing that, trying to stay away from people outside of your family. When there are things that you need to be doing, staying at least 6 feet away from people when possible. As Dr. Vernon said, extremely good hand hygiene. Soap and water is best. If you don't have access to soap and water, you're on the go, a hand sanitizer that's at least 70% alcohol. You don't want to use 100% alcohol, so do check with the CDC guidelines for what you should be using. And then there is a role for universal masking to mitigate risk. It does not supplant the things that we know work. We're still learning a lot about universal masking for this disease. So don't rely on a mask to protect you. But if you use it as an adjunct to these other steps, there probably is a role for mask use.
You know, one of the patients in submitting a question, and I think it kind of sums up how everybody feels, is that they just wanted to go out in the sunshine, but they're afraid just to get some fresh air. So, Dr. Vernon, my question is, what are the signs that will let a mitochondrial disease patient know that it's safe to resume activities in a community area? And especially for those who are able to go out of the house, but yet care for a patient. What are the signs that they should be looking for that's safe to resume?
Yeah, and this is a great question. We hear this a lot, and this is a very complicated and difficult one to answer. And the first thing to say is that this is an answer that's going to be in flux. I think it had been mentioned earlier that we have been hearing that sort of the infection peaks are going to come in waves, and those waves are sort of going to be essentially when some of the restrictions are let up and people are starting to socially mix again or in-person mix again, and then the infection rate and transmission rate may go back up again. It's very difficult to anticipate exactly what that's going to be. And also, I think this was mentioned earlier, in region to region in the United States and in the world, it's going to be almost staggered in terms of timing, in terms of infection rate. So I think something that's very important and information that I can't give for each region is for you to stay in touch with your local providers to find out exactly what's going on within the community, within sort of the infection rate and when they think things are peaking. For a long time, though, I still would recommend, well, what did Dr. Ganetzi say? Not social distancing. There was another word she used. Remind me what that was? I liked it.
Physical distancing.
Physical distancing. I really liked that. I would really recommend physical distancing for the foreseeable future. I would recommend limiting, certainly being in large crowds for the foreseeable future, wearing masks for the foreseeable future, thorough hand washing, frankly, always. It's hopefully something we're just going to get into good habits of doing. And of course, common sense things, but things that are just, hard to remember on an everyday basis. If someone is coughing, sneezing, has a fever, you shouldn't be in contact with them. And really just, again, staying in touch with your local team and finding out what's going on within the local community and recognizing that things may be sort of let up for a little while, but that may back off for a little while. It's going to be a frustrating, long, and fluxing process that will, hopefully get better as time goes on. But we really need to just kind of, go with what's happening in your specific region.
So Dr. Scalia, let's talk about clinical trials. Now, I know there was a question on our last webinar about participation. Are they still proceeding at this time? What are you hearing? Are there active trials, or can people proceed safely in any of these? Or, and if any of you want to chime in on that, that's fine.
Yeah. So there are, I guess, there are two issues. For example, at Texas Children's Hospital, we are, participating in a clinical trial. This has been long-standing. Is the extension phase of EPI-743 for children with Lee syndrome. And there's also the compassionate use using the same compound, EPI-743, and those are for children with mitochondrial disease that have different mitochondrial disorders. So definitely what we are doing in that particular case is that the drug is still being supplied and sent to the families, but we are not bringing those children to the clinical research unit at Texas Children's Hospital, because obviously, first of all, it would be terrible if a child with Lee syndrome would really get COVID-19 or any type of infection, you know, even like influenza. And I think that, but I think that at this point, I mean, I think that we are being very careful. So the clinical research unit is really not bringing, and we are not bringing any of those children for the extension phase. Regarding other trials, we are ready to start now that we transition to another coordinating center to collect data for one particular condition called Miller syndrome. We are ready with all the documentation, but we can't bring those patients. It would also be terrible if they would contract, if they would get COVID-19. So we are postponing the opening or the continuation of that particular trial. So I think that things are in suspense. And in fact, NIH actually had guidelines for like, so the National Institute of Health for like NIH supported trials. And I think a similar approach has taken place for those trials that are supported by industry, really minimizing risk and then just waiting. Yeah. And for the ones that are already taking place, you know, we can still communicate with the families over the phone, and, you know, we can still, for registries, we can still collect like data over the phone or even consent families over the phone. Many things can be done, you know, online or through a phone line now. Yeah.
Okay. Dr. Vernon, can we talk about asymptomatic carriers for a minute? So, a lot of good questions around this. And I don't know that we know the answers to this yet, but I'm going to ask the questions anyway. Do asymptomatic carriers permanently carry this? Or at some point, do they shed this? And if they do, how long does that take? It's an interesting question. I don't know if there's an answer to it, but I'll toss it to you anyway.
That is quite a question that you sent my way. So the first thing is we don't yet actually have the epidemiologic evidence of how many asymptomatic carriers are out there. And that's something that I know a number of states are working on, and New York is a big one that's really getting ahead of the data. And that's because, frankly, I mean, I know within my own state, we're not testing asymptomatic individuals. And frankly, we're only testing sort of those individuals who are sort of more symptomatic than mild, if that makes any sense. So we don't actually quite have that information to know, frankly, how many asymptomatic carriers are out there and what happens to them in the long term. And I'm not sure if Dr. McGuire has anything to answer about this, but I suppose some of the length of the asymptomatic carrier rate has to do with the immune response that's going to be mounted to get rid of that sort of asymptomatic virus. But I imagine over time it is something that will go away, that will be cleared, but something we need to learn more about.
Yeah, Dr. Vernon is absolutely right. We don't know at this point. There are, of course, reports of asymptomatic, presumed asymptomatic carrier transmission. And that's why that raised concerns. There's actually some stuff showing up in the Journal of American Medical Association about carrier transmission. But, you know, one of the important things, and going back to something I was asked previously about, you know, life going back, I don't want to say normal, adopting a new normal. Part of that is going to be essentially having robust testing in place. And that is something that is currently still being worked on. We do not have, at this point, the capacity to test everyone, essentially. The idea also about knowing what's out there in the community also gives you an idea about herd immunity, right? So if anyone's ever heard this term herd immunity, what it means is that there has to be a certain amount of individuals within a community and within a population who have been exposed to the virus and develop protective antibodies against it. And if that number rises large enough, then it helps actually prevent spread within the community. So until the testing comes online in a very robust way, we will not know that. But that, of course, is part of the CDC's guidelines and recommendations for, you know, getting America open again, right? It's not only about infection, you know, prevention and control, and mitigation in communities and stuff like that, but it's about surveillance, and it's about, you know, knowing essentially what that kind of bottom line is in the community. So, you know, once we kind of, as stuff moves on and they are able to roll out testing, we may have a better idea of that.
So, Dr. McGuire, it brings me to my next point. We hear all the time about a second wave. What's the likelihood of that, and what should mitochondrial disease patients do now in the event that that happens later?
Yeah, so those second waves, of course, are predictions. We're all talking about predictions, right? I hope they're wrong, but you know, they probably may not be. And what that means is, even with this herd immunity developing, it still means that you could still have periods of COVID-19, you know, resurgence amongst individuals who are not immune, essentially. So that is kind of that's one of the scenarios that they're talking about, is that the people who are outside of this kind of herd immunity, you can have kind of these, you know, these resurgences as you go on, because they didn't have exposure. So, you know, what should patients do? Well, so, okay, so from our survey, you know, one thing, as I said so far, and we've only had one patient out of 400 something who's reported being positive. So whatever you are doing so far, congratulations and kudos, because that's really great news. Outside of our survey, we've maybe heard of one or two other families, you know, very, very small number. So, so basically whatever patients are doing now in terms of trying to mitigate their risk essentially is working. And those things should be kept in mind if there is kind of a resurgence again. Once again, there's no magic bullet. There's no evidence for, you know, increasing your meds or anything like that. So just, you know, based on what you're doing right now and the knowledge you have right now, it seems to be relatively effective.
So continuing with you, Dr. McGuire, I know that we've heard about vaccines that are being worked on. Will that provide enough protection once it's developed, approved, and gotten through? Would that provide enough protection for our patient community?
Yeah, I mean, that's something that, so that is something that we I don't know the answer to that. And that is something we are looking to evaluate once there is a vaccine that is ready. So, so we did that normally, meaning that we normally monitor through our study, our longitudinal natural history study, the mini study. We normally look at people's titers to the various vaccinations that they receive. So that is something that we hope to evaluate once an approved vaccine is, you know, essentially rolls out. Now, people should realize with the vaccine trials that are going on right now, there are a number of different strategies that they're taking, right? And a number of different companies that are trying to develop a vaccine. People need to realize that some of those are going to fail, right? Some of those are going to fail, and therefore the ultimate number of vaccines that come out of it is going to be much smaller than the starting pot, basically. But the idea is that, right, you are given essentially an inactivated version of the virus or pieces of the virus or something, which kind of trains your immune system to recognize it, so that therefore if you do get exposed to it, you either don't experience the disease at all, you experience a very ameliorated version. But to know specifically whether patients with mitochondrial disease are going to react against this vaccine, we don't know. Because even in our own vaccine study, it wasn't across the board that they were missing everything. There were certain vaccines that seemed to be less efficacious than others in that population. So we won't know that answer essentially until we're able to do the study and get the empiric data.
Okay, thank you. Dr. Ganetsky, you're next with a question about school. So some parents want to know if they should consider sending their children back to school in the fall. We talked a little bit about that possible second wave. So they want to know if that's something that they should be considering, and they want to know what your thoughts are on that.
I think that's such an important question. And sometimes when we deal with uncertainty, our best partner is time. And so I will tell you some of the things that I'm thinking about as I'm trying to make that decision for my patients. And I'm also going to tell you that I bet that we will all have a better sense of this answer as we get closer to the fall. One possibility is, as we get to August, even late July, we're still seeing, lots of adults. Maybe there's been a big second wave and lots of adults have become infected, but we're still seeing in our Mito kids, there's still very, very few, like Dr. McGuire is seeing. Or maybe we'll be in an even more optimistic scenario, and we'll know that we've seen a lot of Mito kids get infected and none of them have gotten very sick. If we're in a situation like that, I would feel really comfortable being like, send your kids to school, especially the ones who are younger, because we know that younger age right now seems to be a better prognostic feature, especially the kids who don't have organ involvement, meaning don't have heart involvement, aren't on dialysis, aren't having respiratory problems. Alternately, we could be in a situation in August or September where community incidence is really high, or a situation where we've seen some Mito kids get COVID and get really sick. And then I would feel a lot more worried about it. And finally, the other thing that I always like to keep in mind when I'm talking about my patients is I want my Mito kids to be kids. Part of the reason that we're trying to keep them healthy, right, is to let them be kids and have their life. So the other thing that I really take into account when I make this decision is, does your school district or something that's accessible to you have a nice distance learning where your kid can really learn and get the services that they need, the EI services? Or if you have a child who's vision impaired or hearing impaired, are they having accommodations so that they're learning in that system? Weighed against, is your school district taking good precautions? Are there ideas about how the kids are going to be socially distanced or on a staggered schedule or something like that to help mitigate their risk? So that's not an answer, but those are the variables that are up in the air as you start to make that answer for your family.
No, I think that you're right. We just don't know yet. I mean, we've got to wait it out. And I'm going to stay with you because we're starting to take questions that have come in while we've been doing this webcast. And one of the questions is, how worried should a person be with a child who has mitochondrial disease and a person who lives in the house that works in a nursing home?
Yeah. So this is, welcome to my email inbox. These are the questions that I get every day from my patients. And what I can say right now is, without having large scale data like Dr. McGuire has, I can tell you that I personally take care of a lot of families that are in that situation, where a family member may be a healthcare worker or in a healthcare setting or in a higher risk situation like that. And I was sharing before everyone else doing the call that I have a couple of families where a parent actually got COVID and got pretty sick. And in all of those situations so far, none of my mitochondrial disease kids have needed to say, yes, they've had COVID to Dr. McGuire's study. So I think that that's pretty encouraging. I definitely think that that's not just a fluke. That's our Mito families working really hard to do good hand hygiene, even change clothes when you come home from work, shower as soon as you get home from work. Some of those things that we would have said were neurotic in the olden days, but now I think seem to be what is working. And with people working really hard to keep their kids safe, it seems to be that that's working.
Dr. Vernon, a question that we got, very interesting. Should we be equipping our patients with a need for early detection to use in the healthcare system? And really interesting part of that question, also they want to know what would the treatments or contradictions, if infected, be should they come down with the coronavirus?
So in terms of early detection, I think something that I'm sure a lot of families are doing already would be, and I sort of mentioned this in my last little bit, but this is really the most important thing, is to stay in close contact with your care team. And that is if there are any worrisome symptoms or even the start of worrisome symptoms, it's important to really contact your healthcare team, contact the team that knows you, and discuss at that point, is it something to come in to be tested and to be evaluated or something to be managed at home? And so again, don't be shy about, and I hope I'm speaking for many of us on the panel, everybody on the panels, don't be shy about contacting your healthcare professionals if there's a concern, if there's a worry, because getting on top of things is better than waiting too long. So I think that's the first part of things. And the second part of things is what treatments would be recommended. I think currently there's really, supportive care seems to be the sort of the mainstay of care for coronavirus right now. Of course, we've seen already some fads come and go. Dr. McGuire really covered what some of those therapies would mean in terms of the mitochondrial disease population, but really supportive care seems to be the thing that is really most effective at this point, and that would be the same across the board, but early care.
Okay. Dr. Marriage, any concerns if a patient is taking an ACE inhibitor?
I wouldn't think that there would be any concerns with coronavirus, and they wouldn't want to stop doing whatever medication they were, but I will refer that to my other colleagues, but I would think they would stay on the same medication. They're on it for a reason, and they would continue doing it regardless.
Okay.
If I can mention this, or as a segue, I think it actually would be more dangerous to have blood pressure that is not under control if somebody gets COVID-19 than continuing on the medication. So I think that continuing the medication would be more prudent than stopping. Yeah.
Well, Dr. Skelly, just to stay with that, so a question that we got from Australia that kind of stays with that line of questioning: is it possible or prudent to drop your A or B or ACE inhibitor and increase your dose, or change to an existing calcium channel blocker or other blood pressure med?
I think the data on ACE inhibitors, if I remember correctly, because we have all been swamped with information overload, I mean, came from a paper that was published early in the pandemic, and I think it was in the Lancet. But I think that the data were not conclusive. I did see some responses or other manuscripts that actually followed that one. I think that certainly that should be discussed with the cardiologist, the person who actually has prescribed, that medication. But like I said before, there would probably be a higher risk by stopping something if it's efficient at controlling the blood pressure. Having high blood pressure is associated with like a inflammatory state, and those people, like people who have diabetes or other problems, or who are on dialysis, they are at a much higher risk of having complications from this infection.
Okay.
Yeah, I agree with Dr. Scalia here. I mean, so yes, that paper came out a while ago. It was not, a while ago in our timeline of COVID-19. I can't even remember, was it a preprint in bioarchives or something even? I don't even know if it made it to full publication or peer-reviewed publication yet. But the thing with so what's the concern here? The concern here is that, being on an ACE inhibitor or an angiotensin II receptor blocker increases the number of receptors, right? And of course, that's the receptor that the virus uses to get into the body. Well, so now the thinking is kind of cutting both ways. Some people are saying, well, yeah, that's an increased risk for COVID-19 infection. Oh, that's horrible. Should we change medications? And then some people are saying on the other side that, well, no, actually it can help prevent, COVID by how it interacts with the receptor, or how it's internalized or whatever. So at this point, really, there is insufficient evidence to really make any recommendations about ACE inhibitors or ACE receptors, blockers, essentially. And I agree 100% with Dr. Scalia in that, trying to switch blood pressure medications is no easy task, right? Cardiologists sometimes have to find, it's not necessarily the single drug, it's the right combination of drugs. So for some people, it would be kind of starting all over again, which can be then very difficult to try to get control of their blood pressure to find that right combination. So at this point, insufficient evidence. people should probably remain or check in with their cardiologists, of course, but the evidence does not suggest changing their medications.
Great advice. Thank you all. Dr. Ganetsky, what is the recommendation for handling ongoing therapies as a state is resuming its services? For example, things like PT, occupational therapy, speech, specifically in a child who isn't going to regress without therapy?
Yeah, I think that's a really important question. And, you know, what we all know is that exercise in specific and physical therapy in general is probably the most evidence-based treatment for mitochondrial disease. And it's really important for our patients. Preventing regression is obviously the most important thing, but I also really feel that it's essential to support progression in our patients. So everything, one of my mentors used to say to me, life is about risks and you have to choose which ones you want to take. In a state that is reopening, assuming that it is a state that is reopening because the community prevalence is lower and the curve is flat, I think that it is reasonable to start talking about and thinking about resuming therapies. What can you do to minimize and mitigate your risk? Make sure that the therapist who's coming is completely asymptomatic. When we talk about the risk of asymptomatic carriers, a lot of those have been people who have had just a bit of symptoms, you know, a little bit of a cough or a little bit of a runny nose. So anything like that, you definitely don't want them coming over. You want them to be doing hand hygiene as soon as they come in. As much as possible, if you can mix more physically distant exercises or even internet exercises with in-person exercises, that's probably the best. But for each kid, you know, for some physical therapy just has to happen hands-on. And then as much as possible to keep it the same therapist every time, so that assuming that you're in a state that has the infrastructure for good contact tracing, you know who that person was. And if they get sick, you'll be able to be notified. And then, you know, making sure that they also are as much as possible in a position that they're able to take precautions in the other families that they go to. And so that they're not going into households where someone might have a cough or a cold and then coming into your house.
Excellent, thank you. Dr. Marriage, this question comes from a parent, and she's talking about her 14-year-old daughter. The daughter is 24-hour tube fed with no oral intake, and she's asking your opinion. Does she need to give her any additional vitamins more than normal?
I would assume not, depending that I'm sure that the tube feeding that's been recommended by her provider and her healthcare professional has looked at that, has made sure that it's a complete balanced nutrition that is meeting all the needs. So I would not think during this time that they need anything different. I mean, it's the same precautions we tell all of our patients, like, let's say during illness, making sure that they're getting enough fluid. If they have a fever, they're going to need more liquids. But really, a 24-hour tube fed, just making sure that it is meeting all the needs. So during this time, I wouldn't think there would be any reason to change anything with that. But just if they got ill, call your physician. Do they need more fluids? Is there anything else that would be changed at that time?
And Dr. Vernon, this is a question from a parent, very concerned about sending children. You know, we've talked about back to school, but this is for workshops that occur.
Mm-hmm.
Very concerned about waiting until a vaccine is produced and the child can be vaccinated. How do you answer those kinds of fears and concerns?
Yeah, I mean, I think this is a theme that we've really heard a lot throughout this webcast. Really is there's just a lot of unpredictability here. And I think the lack of predictability makes this even, if possible, even scarier than it already is. we've gotten a lot of mixed messages around when or if a vaccine is going to be available. I think it's going to be some time, and I would really welcome any input on this from the group. But I think that there are going to be in order to get back into the community and become active again, that's going to predate when a vaccine is going to be available and effective, if that makes any sense. I think that we're going to, have to watch the population tide of disease, look and see how things, hopefully the curves are flattening out and then continuing to reduce in terms of infectivity. And I think that's going to come before a vaccine, really based on a lot of what I'm seeing. And so for now, in terms of workshops, schools, even therapy, doctor visits, whatever can be done via these sort of computer modules, we're even doing therapy, physical therapy over the internet as best that we can, is really the way to go now. And just see if, as these things can sort of lighten up and loosen up as time goes on. But I personally, think it's going to be really more of keeping an eye on what's going on in the environment and the community, as opposed to waiting for a vaccine.
So that would answer probably another question that we have: is it safe to go to a dental office when things open up, especially if they're immune compromised? I mean, that would fall into that next line.
Yeah, so I would not wait on a dental infection, something that's going to get worse and put somebody's life at risk. One of the things that we're hearing about actually in our own hospital, which is rather scary, is that there's reduced visits for serious things. We've had reduced presentations for stroke. We've had reduced presentations for heart attacks. And it's not because these things aren't happening to people, it's because they're afraid to come to the hospital. And so things that are infections, neurologic symptoms, chest pain, things like that, we should not be waiting to seek care. We just need to seek it in a safe way. Things that are sort of more elective, like getting braces put on, maybe going for a dental cleaning, that would be something that could be put off, but I would not put off something that poses a health risk.
Well, actually, you lead me to my next question for Dr. Scalia. So, and we just saw this the other day about blood clots and strokes in younger people as a result of the COVID virus. The question is there some benefit for mitochondrial disease patients to take an aspirin or some other anti-clotting drug to avoid this risk?
Well, I mean, I don't think that we have a final answer. We don't have data. I mean, you're correct. I mean, that there were reports that actually in younger, let's say, in the younger segment of the population, there were more issues with strokes rather than respiratory problems, rather than problems in the lungs, or lungs being flooded. So, but I don't think that for our population of patients, I don't think that we have enough data. And I guess I could also say that, for example, there are some mitochondrial syndromes that actually we deal with, like MILAS, where the type of strokes that those patients get are not necessarily the type of strokes that actually are going to be prevented by taking aspirin. So really, it's a different type of stroke. So I don't think that we have enough information to say, yes, we should come with that recommendation. Yeah, but it's an excellent question, and I think that I welcome anybody else to say something about it. Yep.
Okay, Dr. McGuire, last question for you. The patient that asks this question has an underlying mitochondrial disorder, and they work in healthcare. And they want to be able to return to work when appropriate. Right now, they say they've been fortunate to stay at home, but that's going to be temporary. So they're asking, when would you recommend that it would be safe to return to work delivering patient care? And anybody can chime in on that if you like.
Yeah, so yeah, that's once again, all these questions are really difficult questions. It really depends on their workplace, right? And what their workplace is doing during this crisis. So when they say healthcare setting, I'm not sure if that's a home for aged people, or is it?
No, I could tell you, it's orthopedics, non-COVID patients.
Yeah. So I think as things kind of get back to whatever that new norm is, it would be paying attention to what once again, as was said before, what is going on in the community. what recommendations are being made by state and local governments with regards to work, but then also, most importantly, paying attention to your own workplace in terms of, what types of patients are they seeing? How are they being scheduled? Are they crowding the waiting room and really seeing large volumes of patients, or are they, trying to spread them out? These are things I think that would be important to pay attention to in terms of their own health. There's kind of no magic formula here. It's just more kind of assessing, once again, as many people have said, it's assessing risk, right? And therefore, if you feel confident that your employer is putting in those critical steps for mitigating risk for you, then it's something to consider. But you have to feel safe. You would have to feel safe, and without knowing this person's particular mitochondrial disease, and the degree of which, is it myopathy, or are there other things involved? Without knowing that, the general answer that I can give is assessing, as I said, the employer's implementation of strategies to mitigate risk.
Okay, that wraps up all the questions that we have, and I would like to thank all of you. It was truly an honor for me to ask the questions our patient community has to all of you, and for your incredibly wise counsel and answers to our patient community. So thank you very much. Also, before we leave, want to tell you that you can go to umdf.org/coronavirus and get the information about the survey that Dr. McGuire was talking about. Also, tomorrow we will have a link to this recording for this webcast, and we will also put that on our YouTube channel, so you could go over there and see the first webcast that we did, and then this webcast. So thank you all again. Thank you very much for helping us tonight. We really appreciate it on behalf of our patient community.
Thank you. A pleasure. A pleasure. Thank you.
Thank you. And everybody have a good rest of your evening.